What I'm about to talk about is one of the things I lose sleep over at night, and that is what will be the next pandemic. Because I don't think COVID was the last one we'll see for a while. I think there could be another one again, and I think the Trump administration's policies have increased the risk tenfold. Now, before I get into it, make sure to subscribe, like this video, and share it with your friends. Now, the next pandemic could be Ebola. It's a scary word, and it is for a reason. This is one of the worst diseases that exists on the planet. It is not fully controlled, and if it gets to the mainland USA and spreads, we are in for serious, serious trouble. It will make COVID-19 look like a walk through the park. One of the reasons this would be so much worse is that the case fatality rate on Ebola is 50%. Compare that to COVID-19, which has an average case fatality rate between 4 and 11%, much, much less. Now, Ebola virus is mostly contained to some African countries, but cases have made it here to the United States. And we know this because we had a system of tracking this that was very robust. We had a fully staffed operational CDC tracking this. We had a infectious disease response team that was robust. And Trump and his administration have seriously dismantled and reduced our ability to respond to diseases like this. The first case of Ebola here was back in 2014 when a man traveled here from Liberia to Texas. There were 2 other cases later of 2 American healthcare workers that contracted the virus and were evacuated from West Africa. And there has been secondary transmission to nurses in hospitals, but that's it. No community spread has ever happened because we had such a good, robust system to manage this. Now, you don't have to be too concerned because there are currently no active cases of Ebola in the United States, and we want to keep it that way. But that's why I need everyone to speak up, share this, and spread the word. We need to make the Trump administration hear us and know that we need to take infectious diseases seriously. RFK Jr. wants to end the focus on that and focus more on chronic diseases, not these diseases we know can come here and cause major, major damage. We just went through a pandemic, and we do not want to do that again. We are not even fully recovered from the COVID-19 pandemic. The country is really still reeling from that pandemic and the shutdown. And if this disease, Ebola, gets here, which is more than twice as deadly, we are going to have a much tighter shutdown, even more restrictions, because this disease is even more contagious and causes way more severe sickness. And one of the problems with Ebola is the early symptoms are similar to that of COVID-19 or the flu, where you have muscle aches, cramps, nausea, vomiting, sore throat, headache, tiredness, a fever over 101, diarrhea, and then that leads to way more severe symptoms that include bleeding from the eyes, bleeding from the nose, gums, or mouth, and then there's more serious symptoms that occur, like vomiting with blood, diarrhea with blood, skin rash, things like that, trouble breathing, and then eventually organ failure. There is no cure for Ebola virus, but there are treatments that can help you increase your chances for survival. The good news is there is a vaccine for this virus, but it's not given widely here in the United States. It's only given to those who are considered at risk for this. So there's a vaccine, and it's for the most common strain of Ebola, but it's not given for general use. And with the current environment in our Health and Human Services Department, RFK Jr. and Trump changing the recommendations and guidelines for vaccine use, I find it highly unlikely this vaccine will become available for commercial use under this Trump administration. Aside from the reductions at the Department of Health and Human Services and the CDC, the Trump administration has essentially eliminated usaid, which served a critical role in maintaining and controlling Ebola. USAID was the lead federal agency coordinating the response to the outbreak of Ebola in 2014. They have supported disaster and humanitarian needs in the affected countries. They supported the construction of Ebola treatment units, provided supplies like personal protective equipment. They would train healthcare workers on how to deal with Ebola. They would help manage burial of people who had passed away from it. They conducted contact tracing and provided risk communications. They have been the lead agency responding to later outbreaks like the one in the Republic of the Congo. And just to put this more into perspective, Elon Musk and Doge canceled Ebola aid in March of 2025, and this was aid that was supposed to go to Uganda. You probably didn't hear about this because the mainstream news has not been reporting on it, but Musk canceled Ebola aid to Uganda and then quickly reinstated it, but they didn't reinstate all of it. So they left much of it canceled. They officially ended 4 of the 5 U.S. Ebola contracts to that country alone. USAID in Uganda went from 50 staffers to handle the outbreak to just 6 people to handle this huge outbreak of Ebola in that country. Now, what's compounded these already dire situations that have occurred because of the Trump administration's policies is just Friday, they went and fired people at the CDC who were responsible for handling Ebola outbreak responses. Now, the Trump administration said these firings were in error and weren't supposed to happen, some sort of clerical mix-up, I guess. And now they have been working over the weekend to rehire these people they mistakenly laid off. So hopefully they all come back, but we don't know yet if they're bringing everyone back who was handling the Ebola response in the Republic of the Congo. In the end, we just cannot afford to lower our defenses to infectious diseases like Ebola. Now, I'm not saying this is going to be the next pandemic that we face here in this country, hopefully not, but it is a possibility. But there are other diseases that could also arrive here also. There are also unknown diseases that could pop up like COVID-19. So we have to be prepared. We have to have the systems in place to respond and handle this and manage it. And right now, we just don't have the confidence that they are in place. This should be one of the #1 things we're talking about in the news, but the mainstream media just fails to report on this. And we just don't want to go through another pandemic again. We've already done that. We need to make sure another one doesn't occur for a very, very long time, and hopefully never again. Let me know what you think about this in the comments. Let me know if you agree with that. Like, share, spread the word, follow, subscribe, and I'll see you back here for the 411.